Okay, so today we will be exploring an essential foundation of patient care, which is the vital signs. So these are the key indicators of our patient's health and bodily function. Ang kasama dito ay yung temperature, pulse, respiration, blood pressure, and oxygen saturation. So pag monitor natin nito, we can assess yung health status ng ating pasyente, we can detect early problems and make informed treatments regarding sa ating patient care. Next. Bago tayo magsimula, let's try to play a game. Um, are you familiar with Kahoot? So, ang Kahoot is a short game that will help us see kung ano na yung alam natin about vital signs and where we might need to spend more time with. Okay. So, gagamit lang tayo ng smartphones and laptops natin para maka-join sa Kahoot. Okay, let's go. Okay, let's start. So, ang game pin natin is 594-8086. Again, it's 594-8086. Okay, so we have three players. So what is the normal range of an adult's resting heart rate? Very good. All of them got the correct answer. So what is the most common site for measuring an adult's blood pressure? Okay, very good. So which of the following temperatures is considered a fever or pyrexia? Okay. A blood pressure reading of 115/95 millimeter mercury is considered very good. It's second stage hypertension. So this is the last. What is the normal respiratory rate for a healthy adult? It's 12 to 20 breaths per minute. Very good. So for the podium, Thursday at third, Aki at second, and Boots on first. Congratulations. Okay. So for body temperature, so let's start with body temperature. A normal body temperature is 97.8 degrees Fahrenheit to 99.1. Or in Celsius, it's 36.5 degrees Celsius to 37.3 degrees Celsius. So we can measure temperature through different sites. It's orally, axillary, tympanic, temporal, and rectal, each with slight variations. Yung factors like age, time of day, activity level, and hormonal changes may influence body temperature. Next, pulse rate. A normal pulse rate is 80 to 100 beats per minute. We usually assess it in sites like radial, brachial, carotid, and apical arteries. Pulse can also vary with age, fitness, medication, or emotional state. Be alert to with abnormalities like bradycardia, which refers to a slow pulse, which is less than 60 beats per minute, while tachycardia is a fast pulse over 100 beats per minute. Both can signal underlying health problems. Next is respiration. Respiration measures how many breaths a person takes per minute. With normal adult, it's between 12 to 20 breaths per minute. It is best assessed by discretely observing chest movements. Factors like age, anxiety, exercise, or respiratory illnesses can affect breathing. In clinical terms, we must know includes tachypnea, which is fast breathing, bradypnea, slow breathing, dyspnea, difficulty breathing, and apnea, absence of breathing. Blood pressure measures the force of blood against artery walls with normal reading at 120 over 80 millimeters mercury. We can measure this using a sphygmomanometer with a stethoscope or a digital monitor. So proper technique involves auscultating crackle sounds while gradually deflating the cup. So you have to pay attention to abnormalities like hypertension, which means high blood pressure and increases the risk of strokes and heart attacks, while hypotension refers to low blood pressure, risking or organ perfusion. Autosaturation, or SpO2, shows how much oxygen the blood carries. The normal range is 95 to 100%, measured using a pulse oximeter. We can place the sensor on a fingertip, earlobe, or toe. Factors like poor circulation, cold extremities, or even nail polish can interfere with accuracy. An SpO2 below 90 indicates hypoxemia and requires immediate clinical intervention. So, let's try to explore virtual simulation. Let's access API. Okay, so this is the dashboard of the API. We will be going to simulation, skills module 3. Then we're going to be accessing virtual scenarios. We're going to vital signs. So this is a scenario. Our patient is Mr. Alfred Casio. Our patient is Mr. Alfred Casio. Identify expected. So as expected listeners, we have to demonstrate knowledge and techniques. Identify expected and unexpected vital signs results, implement interventions, and address unexpected vital sign results, and determine when a reassessment of vital signs is necessary, and we have to use the chart if necessary. So this is the scenario. So at the beginning of the shift or client interaction, which of the following should we complete? So select all that applies. So should we provide privacy? Um, perform hand hygiene? Introduce or dim the lights? Let's begin. Okay, so this scenario was terminated. Why? Due to failure to address client privacy, safety, and infection control measures in performing the skill. So we have to remediate. Now, in remediation, there are resources that we use with API. There are ebooks, there are videos, and there are pictured resources that we could do. Again, let's go to skills module, learning module, then go to vital signs. So this is the overview of the topic with regards to vital signs. There you go. Continue. There are also videos we can use. So if you have observed, the nurse had guidelines with regards to before doing the vital signs. Earlier, sinadya natin na pagka mali-mali yung steps in doing the vital signs para mag-remediate tayo. Now, with regards to the remediation, now that we know the step-by-step, we will be using the step-by-step that we have learned here, and we will be going back to the simulation. But first, let's try to um, watch some more. So, this is the accepted practice when we are to get the respiratory rate. The inspiration and expiration. Also, some. Yan, ano nakikita mo? Hmm. Okay. So when interpreting vital signs, there are four steps: collection, documentation, analysis, and intervention. In collection, gather a complete, accurate set using correct methods. Documentation is record measurements carefully, including time and relevant conditions. Analysis compares the findings on normal ranges and the patient's baseline. In intervention is we report significant changes and initiate appropriate actions based on the situation. Next is vital signs documentation. Paper records like flow sheets are still widely used for tracking trends over time. Electronic health records allow easier trends analysis and automatic alerts for abnormal values. Point of care documentation using mobile devices enables real time recording, reducing error and enhancing patient safety. So we have to remember that accurate documentation is just as important as accurate measurement. The next is how often or gaano kadalas ba tayo nagde-take ng vital signs? Typically, it's every 4 to 6 hours in hospitalized patients or more frequently if needed. With proper technique and calibrated equipment, we can improve accuracy by up to 80%. Now, the five core parameters: temperature, pulse, respiration, blood pressure, and oxygen saturation gives us crucial insights into patient health. Now, vital signs help us detect changes before visible symptoms develop, allowing early interventions that can save lives. Then lastly, we are to have a post test. Now, with regards to the post test, we can see the link, and let's okay. So this is the Google Drive. Oh, sorry, Google Forms for our post test. So there are 5 questions in the post test. So let's try to answer them. So what is the normal adult respiration? What is the which of the following would be considered as an abnormal pulse rate? So 80, 60, 100, 80. Blood pressure is measured using a pulse oximeter. Pulse. SpO2 reading shows 88%. So after the post test, you will be writing a personal reflection